Okay, and I just want to say hi. Welcome tonight to Broker Academy Welcome Series. Today we're going to be talking about broker resources, and we are super excited to have everybody. My name is Ellen Laramie. I work in outreach at Access Health Connecticut, and I am joined by the lovely Gigi Garcia and Bart Graham. And I don't see any more of our coworkers on the phone yet, but they may be joining us later. So today, one of the things we were hoping to do is if you get a chance, if you're able to, can you put it in the chat, your name and what county you're from? We would love to have that in there for people to be able to get an idea. I want to also say that we have sent you an email on Monday and Tuesday this week. If you didn't see it immediately, check your junk box, but it should be okay. And what we'd like you to do as part of that is to there's a link for a poll. So you go to those emails and do the poll. And it's going to ask you some simple questions that'll help us get ready for the Broker Academy training on June 1st, 2nd, and 3rd. So another thing, our director, Tammy Hendricks, Director of Health Equity and Outreach, asked me just to share is if you're missing any documents and you're aware of it from our recent phone calls, and you haven't sent it in yet, if you could please get that in, that would be fantastic. But we have a lot of great stuff from people. I know you've been doing your acceptance letters and your background checks. So thank you all for doing that. We really appreciate it. Looking at my notes, it looks like we're good to go. So I am going to turn it over to Bart.
Good evening, everybody. I'm Bart Graham. I'm the broker and CAC support lead, and I'll be getting the show started.
Okay, you can see it okay, Bart?
Yes, I can. Thank you. So as you can see here from the title, we've got just a few slides on resources for new brokers, things that you may want to keep in mind, things that can be helpful to you in your journey to becoming brokers. Next slide, please. Next slide again. A few of the things that we'll be going over tonight are National Producer Number, or NPN, state-based systems, or as we call it, SBS, the Connecticut Insurance Department, also known as SID, the Department of Social Services, Medicaid, Medicare, and the differences between the two, some quick links, and just some ways to reach us throughout your process. Slide. So the National Producer Number, that's your unique identifier that's going to be assigned to you through the National Association of Insurance Commissioners licensing application process. That's used to track individuals and business entities on a national basis. So that's going to be a number that'll be pretty close to no matter what you're doing, generally speaking, in the broker world. Next slide.
Sometimes it's easy.
So state-based systems is actually it's just recently updated. It's an electronic system built by, again, the National Association of Insurance Commissioners. It's designed and enhanced in partnership with regulators that automate the state-based insurance regulation operations. It's a system of choice for more than 50% of all the NAIC members. More than 2,000 regulators use this system every day and to access a database of 1 million unique producers, 10,000 education providers, and more than 9,000 companies. A lot of information. With SBS, you can look up your own NPN number, manage your appointments and compliance with all the carriers, as well as update your contact info and track any appointment or license renewal dates that you may need to look into. Slide. So if you use this link, this will take you to the state-based systems website here, and the lookup button That's the button that you would want to use in order to look up your information. Slide. And then once you do get into that link, this is the page that you're going to see. And these are the pieces of information that you'll want to put in here. So obviously Connecticut is going to be our jurisdiction. Search type would be your licensee, and entity type would generally be individual unless you do become associated, with maybe a company. Obviously, the rest of the information is circled here. Another piece of information that is important to know is your producer's license has to be renewed every 2 years through the state. Next slide. And the Connecticut Insurance Department, again, we refer to that generally as CID. It's to protect the consumers and fair regulation through fair regulation of the insurance industry, outreach, education, and advocacy. They're basically kind of, in charge of all the licensing and NPN numbers and all that for our state. And again, there's a link to their website, and they've got a little bit more information out there as well. Slide. And with that being said, I'm going to turn it over to Gigi Garcia for the rest of the slides.
Good evening, all. Today we're going to make it really short. These are just going to be resources to you, so that way when you become your brokers, you have access to the stuff you may need out there. So next slide, please. So for the Department of Social Services, you may encounter these programs out there when you do applications through the exchange. So you may encounter, can you go on to the next slide, please, Alan? So you may encounter plans for Husky A, Husky B, C, or D. So these different types of, you may also know some of these and you may not know them, but these plans are different for different types of family households. So for Husky A is for more for parents and children that are under low income for the federal poverty level, which will give them free services to them, medical, medication, dental, vision. Husky B is more when the household has an income that's above the Husky A poverty level, but they still qualify for the Husky B. And this is just for children under the age of 19. So when mom and dad are on a QHP with tax credit and no tax credit, children can also still qualify for this policy for the Husky B plan. They also cover medical medications. They also cover dental, but Husky B, some of these have monthly premiums and some don't. So there's Husky B Band 1 that doesn't have a monthly premium, but they do have co-pays. And then Husky B Band 2 is the one that has the premiums, and depending how many children in the household, it'll be lump sum. So for each child, I believe it's 50, but it'll go up to like maybe 3 to 4 kids. So if the family member has more than 4 kids, it'll be just the limit for a monthly premium. And then Husky C is more for those that are above 65, they're under Medicare, or those that have disability, which they are under, I believe is SSI, which is a supplemental security income. Or but the Husky C we don't manage through Access Health. This, and the reason we're talking about these is just in case if you do get encouraged to get certified through Access Health, then these will be within your training as well when you do get it towards September, October. And then Husky D is for those that are older than 19 and younger than 65, that they are in low income, that they will qualify for the Husky D. And those services are also free for medical, dental, medications, and vision. Next slide, please. Medicare is for those that are turning, they're 65. So let's say if we have a family or someone through Access Health and they're about to turn 65, Access Health will notify them 60 days ahead before their birthday to let them know to try to reach out to Social Security and start applying for the Medicare. We don't take over the Medicare process. So what we do is we just advise them to go through Social Security for the Medicare Part A and Part B. And then we also let them know about choices to cover the other part that they can't cover. Next slide, please. And these are the quick links. This presentation is gonna be for you guys to see towards the end of the week. So what we did was we put on this presentation these clickable links, and where you could go ahead and start navigating, so that way you could see how each website works. So we provided you with the SBS, so that way you can see kind of how the state-based system looks, and kind of you could just navigate around it. Same with the lookup, how Bart mentioned just a few slides ago. So that way you could just look up yourself when you start having your own license. You could just see how you're appointed by the carriers, your license, when it's gonna expire. DSS, Department of Social Services. So that way, if you need to get in there for more information, in case you do encounter, family members with Husky A, B, or D, you could go in there. Same with Husky. Husky will give you more detail about what the other plans cover. And then choice, it's what's given to those that become Medicare eligible. And then next slide. So maybe Ellen could talk more about these links, but these are where you could send all your concerns and questions if you have any. I'm thinking there's some questions that came through for that. I'm not sure, Ellen, but for the resume, can they send it over to the broker at AHCT Broker Academy at ct.gov?
You're exactly right, Gigi. They would send it to that inbox, ahct.brokeracademy@ct.gov. And we'll put that into the chat too. And I just want to say that any questions you have about Broker Academy, this is the place you're going to go, and it's in the chat box too to help you. And we have our website, and then also in the chat, I put that individual page we've made particular just for your group, and that's the accesshealthct.com/BA training. And so at that page, you can find a Zoom link for these calls, and you'll find the PowerPoint presentations, like Gigi said earlier. They get posted on Fridays, and also the recorded versions if anybody misses one and they're interested in looking at it. Yeah, I think it's a helpful page with information. I didn't see any questions in the chat box.
But I do want to say thank you for those that did clarify. Yes, it is for SSI and SSDI, the Husky Seek. That is correct. Thank you. I did miss that one. Next slide, it's our website. So you could find us anywhere in Facebook, Twitter, YouTube, Instagram. You could follow us. And then you could probably talk about a little bit more what happened this weekend, that we're always around the community as well.
Oh yeah, we're out in the community this weekend. We're at Dunkin' Donuts Stadium. We do a lot of outreach, and we often see the our community partners, Anthem, Blue Cross Blue Share or Connecticut out at these events too. So if you have any suggestions for events, if you want us to come to your local church or another community partner of yours, we're happy to do that. And you can just use the same email address box and we'll get back to you. So I see the chat box, there might be a couple questions. Yep, and Karen put in another email address for the documents, ahct.brokeracademy.hr@ct.gov. But if you send it to either address, we'll get it over to the correct HR box. Can we send that event via info? Yes, or you can do that for events. That would be fine. That's, we both monitor those email boxes.
Yeah, definitely. Thank you, Karen. Thank you, Alan. And today is really short, the presentation. We just wanted to make sure that you have all these links, all these resources to you. So when you do become, I have faith that you all will pass and you will have your license, that you all have these resources to you. So that way, if you need help, we're always gonna be there to help out. And if we could have to reach out to other departments, you have the links there. Same way with us, we have to reach out to some just to see what's going on. We're always here to help.
Did anybody want to take themselves off a mute and ask a question? We're happy to try to answer any questions you might have. I do see from Doris, she put something in the chat. How will Husky for All Immigrant Children impact access? We don't have information on that yet, I don't think. Is that correct, Gigi?
It just passed a couple of days ago, basically the past week.
Yeah.
So it was covering up to the age of 8, and now it's covering up to adolescence. So I was just wondering when you'd be updated, and I apologize for the baby crying.
That's okay. That's a little baby.
Love baby crying.
Yeah, we love little babies. Yeah, but what happens is when legislation passes, it goes to our legal department, and then they'll send us out something in writing so we can make sure we have 100% like a full answer for you, Doris. So don't worry, we're going to be getting that out there. And kudos for you for multitasking and using the icon again. It's very impressive.
I do have a link, Ellen, from legal that I can share that does have a little bit more information on that.
Perfect. Thanks. And
I'll put that in the chat.
Thanks, Bart. That's the perfect place to put.
Okay. Hi, good evening. This is Janelle. I have a question. And are you guys any closer to figuring out the times for the classes on June 1st, 2nd, and 3rd? Because some of us do have children and we have to drop them and pick them up. So I understand it was being thought of from 8 a.m. to 5 p.m. That's really a long stretch because people are going to school during that time. So is a 9 to 5 a more feasible time?
I believe they're going to be sending out a letter in the next week, and it is 8 to 5 right now.
Okay.
Yeah, there's a lot to get done. But instead of adding an extra day to the class, we were trying to get everything done within those 3 days. So that Wednesday, Thursday, Friday, June 1st, 2nd, and 3rd, 8 a.m. till 5 p.m. And again, they're going to send you something in writing in the next week or so. Any other questions?
Yes, I have a question. Can you hear me?
Yep. Hi, Vicki.
Hi, how are you? Did they decide where is it going to be?
Yes, so they were sharing, we have the 3 locations. There'll be one in Hartford at Capital Community College, one in New Haven at Gateway Community College, and one in Bridgeport at Housatonic Community College.
All right, all central down low, all central.
So, yeah, they're all in those communities that we really were piloting the program in, and they also have access to public transportation, and that was important to us.
Yes. That's great. That's great.
Yes.
Thank you.
And again, something in writing will be coming out in the next week or so.
Okay, will there be ticket validation for those of us that have to use parking garages?
You know what? I don't know how it exactly works, Janelle. Again, the letter is going to be coming out, and I know they really want the training to be free, so I don't think it's going to be a problem at all. Any other questions? Could you please share information about seeking a job after we are licensed? I don't have anything on that today. Do you, Gigi?
No, I don't know.
No, the only thing that we know is we're doing the pre-training. So we have 2 more classes. Next week, we have a professor coming from Gateway. He's going to talk about effective communication skills. And then the following week, we're going to have somebody coming from the training center from Kaplan Training that we've hired to talk about what the training looks like and what you can expect for support materials. And then we know we're going to, you will have digital materials and some other materials. And then after you pass the exam, hopefully by the end of July, we'll start 90 days with a broker mentor. And so we're working on that right now. And then after that, it'll be up to you or between you and the broker you're working with. And I think there'll be more information during the 3-day training.
I have another question. If we are certified, if we, after we've passed our exam and everything, and if we decide to certify with Access Health CT, would it be a set number of hours that we have to schedule, or would we be able to, is it flexible where we set our own hours?
So once you become a licensed broker, in the fall, Access Health Connecticut is when people become associated with us. They take a little online training class, and then our open enrollment starts November 1st, typically till December 15th. It's often extended to January 15th. And at that point, it's really up to you. It's flexible, who you want to write health insurance with. We hope, we like Access Health Connecticut, so we hope you will join us. But it's really flexible for the brokers when they want to run their businesses.
Thank you.
See a couple stuff in the chat. Is the mentor affiliated with Access Health Connecticut? They have been so far. I don't know if 100% sure they will be by the end, but so far they have been.
The mentors are certified through Access Health. Yes.
Okay.
Yeah, they are trained to do through the exchange.
Perfect.
Mm-hmm.
I don't know if this has been answered in the past, and I apologize for the baby in the back, but I was a little bit confused if we're getting licensed, right? What makes us brokers here? I was under the impression that this license just makes you an agent per se.
No, you'll be a licensed health insurance broker.
So would this mean that we can hire someone?
No, I don't know if you can hire somebody.
Terminology mixed up, because I was under the impression that if you have a broker license, that means you can manage agents, if that makes sense.
You know what? I don't know. I'm not a licensed broker myself, but I can ask.
A lot of the brokers take the terminology agents as they are certified agents to sell health insurance, life insurance.
Right.
But let's say if
brokers can too. However, brokers, I guess in other areas, they have the leverage to supervise other licensed agents, if that makes sense. I don't know.
No, we do have certain companies that have tons of brokers under them, and they do manage their own clients, but that's with the agency and the agents of how they want to manage the commissions and all the hourlies and how they're going to manage the workflow. But what we're offering during the Broker Academy is we're offering, what was it, 60 days, was it, with a mentor?
90 days.
90 days, sorry. So we're just offering the mentor for 90 days, just so that way, for those that are new to becoming a broker, know what the ins and outs of being a broker.
Right, to help you get rolling. And whether you choose to stay with them or not will be between you and that broker. We're really, once we do the pay for the license and get you through the 90 days, then you're on your own. And there'll be more information in the class about that too. The test we are offering to pay for is the health insurance / life insurance broker. And that's what you'll be prepared to take. I see that's one of the questions. And another question, as a broker, would we only be doing Medicare? No, that the test would make you eligible to do any type of health insurance.
So the question I have is piggybacking off of, I forgot her name that she was just on. What's the difference between a licensed broker and a licensed insurance agent?
No, the license for a broker is for life insurance and health insurance. It's what you're doing the test for. It's for life and insurance together. So right now you could come through the exchange and sell health insurance. Same way you could sell out of the exchange and do health insurance. Same way you could do and sell life insurance.
Okay, so, but the thing, my question was, is that, excuse me, my question was that when she was asking my interest, she piqued my interest when she was saying that, and forgive me for not knowing your name,
Gigi. Oh,
not
no, the
you.
late, Nessie?
Yes,
Okay.
and so my question was when she was saying that licensed brokers can manage because of their license, they can manage the health insurance agents. So I was saying what is that's why I was asking what was the difference.
Right,
The
so
word broker and the word agent are basically synonymous. Like a broker and an agent is kind of the same thing. An insurance
Yeah.
broker, insurance agent, it means the same thing. Like if you want to manage people, you absolutely can, but I mean, that's kind of, you would, again, as Gigi said, that would kind of be up to, a firm if you
You have
wanted
your
to
own firm,
join.
thank you
your
for
own
clarifying.
company.
A little bit confused. And I already have my life license. So in order for me to manage other people, I would have to get like a Series 6 or a 63 or a 7. And in order, for realty as well, if they're a realtor, in order to manage other people, they can become a broker, and that requires a different license. And I guess I was mistaken. So I apologize about that. And I guess for purposes of Access Health, it is interchangeable, the word agent and broker here, not in other areas.
You know what, Nessie, we're gonna ask, and we'll send you the information out about that. But
You're going to send it to everybody?
yes, Vicky.
Okay, thank you.
Yeah, and if we don't get the answer in time, we'll talk about it next week too. And then I do see somebody wrote in here, what if we're unable to attend in person? It's mandatory to attend in person the 3 days. So the class is only offered in person. So we just want to be clear with that. And I think we've mentioned that every week. So.
There's more questions in there. And
I think they're all back to what Nessie brought up. And so, we'll look into it. I don't have any more to say about that. Can you, because really we don't know, but we'll be happy to ask and see what they tell us. Tell us about the Access Health Connecticut certification test. Maybe Gigi, you could tell them a little bit about that once they're a broker.
So that comes after you've had your license, you're taking your test, you passed, you have a license, and then you do your mentoring, and then you would do the access test?
If you're interested to sell through Access Health, yes, there'll be something that you could do on your own time, because there will be a link sent to you with the user ID and a temporary password. What you need to do is just sign an agreement that we usually send out first, and then we send out the curriculum. But you have to read the actual agreement that's in there for the brokers. And then after you do that and sign it over electronically, what we do is we add the curriculum. We'll send it out to you, and then you usually have like a month for you to complete it.
Okay.
But it's always something you could always go back in and come out, like save wherever you left off and go back in to try to finish it.
And so that is what, when you say we become associated with an insurer like Connecticut or Aetna, this is the same concept of becoming associated with Access Health.
That's so that way you could help clients that are applying through Access Health, that certification.
So that means we can sell policies
through
that
Access
are
Health, the
being sold
exchange.
on the exchange.
Correct.
Okay.
I see there's a question, the next step, if you choose a Series 6B, you're gonna have to wait till you go to the class. I don't have an answer for that, Clarissa. But I'm sure at the Kaplan training, they'll have more information about that. And that's a little ways, just a couple more weeks away.
I have
And then-
another question. So once, like, for example, if we're certified, decide to get certified with Access Health CT, do you guys provide the leads, or do we have to find our own clients?
You would be finding your own clients. Once you become certified, we do have a list of certified brokers. If you go to our website at accesshealthct.com, if you go to the top of the page on the right, it says Get Help. It'll have a drop-down menu. It'll have Find a Broker, and people put their zip code in, and then there'll be a list of brokers in that area near that zip code. They can also say, I'm looking for a broker within 2 miles, 5 miles, 10 miles, and that depending on how broad it is how many brokers will show up. So we will put you on our list, but we don't send out leads per se.
Our call center, when consumers call the call center and finish an application, if they do wish to speak to a broker after, what the call center's policy is, they send the 3, they would put in, basically do the search that Ellen just mentioned and offer the top 3, brokers in that area and give them the contact info. So you essentially would get a lot of your, just traffic to your, to you in that manner as well. So while we don't have leads, there will, be business naturally coming to you in different, certain ways like that. And we have enrollment fairs throughout the year that you can sign up, or throughout the, open enrollment season. And, you can attend those. There's a lot of different, ways to gain clientele.
I see there's a question in the chat. What if I have jury duty? I'm assuming because I'm serving right now. Honestly, we only have these 3 days in person. As we get closer to it, we can look at it, but we really need you there in the class. And then Clarissa, will we be registered with the marketplace if you take the class that Gigi and Bart have talked about? And that'll be offered in the fall, and we'll make sure people have information for that. And then I see the Zolos. I think there's 2 of you. You have your hand up. You want to unmute yourself, and you can.
It's Gail.
Hi.
Hey. So I just wanted to know if you found out whether or not Faneuil employees, if we'll be able to still work at Faneuil and be a broker. I mean, not at the same moment, like
Agreed.
when I'm scheduled for Faneuil, obviously I'm not working as a broker, but when I'm not scheduled with Faneuil, will I be able to work as a broker?
You know what, Gail? They told me that anyone should talk to their employer about how that would work. That was their
Okay.
recommendation. Because
Because I
again,
know,
we're paying for this. We want everybody in the community, but it would be between you and your employer.
okay, yeah, I mean, I know I wouldn't be doing broker work if I'm working for Faneuil, but like on my own time, that's what I was wondering about.
Yeah, you're gonna have to ask back at the work.
Okay.
I know for those of us, with Access Health directly, some of us will be taking like an internal version of this training, and we are not allowed to. I'm not sure how that would translate over to Faneuil though. I don't know if that's, I guess, not really helpful, but maybe it's something.
Yeah, Gail, just talk to your supervisor.
Yeah, that's what was suggested today in our big meeting. Question in the chat. Faneuil's our call center. So we have a call center, and actually I'm not even sure they're called Faneuil anymore. I think they have a new name. They're in Bristol. And so we have an 800 number, an 855 number, and all of the calls are routed through there. And then at Access Health Connecticut, we actually provide support to them if they need additional help with questions and stuff. And we're very grateful for our partnership with the call center. Great job.
So the call center, when a consumer goes to the Access CT website, or they dial that number.
Yep.
And they want to talk to somebody, they are talking to Faneuil.
Yep, they're our call center. Yep, and a lot of the people at the call center were interested in becoming brokers, and so we're grateful to have them as part of the journey.
So is Fanuel a separate organization from Access Health or
Yes.
part of Access Health?
No, they're
So
separate.
they are separate.
Yep. Yep,
So
they're
how do you
separate.
spell that? Did I spell that right? F-A-N?
Yeah, and honestly,
It's
they just changed their name.
It's in the process. It's not been finalized.
Oh, okay.
We're still Faneuil. I think we
somebody
have a couple more weeks.
And
I know how to spell it. I was gonna spell it for them, but you know,
Thank
somebody
you.
want to talk over each other.
I see it in the chat.
Okay,
Yay.
thank you.
Richard, oh, if this is mine, why is it not on here?
I'm gonna put the poll up, and if we get more questions, we can go back to it, just in case anyone not letting me put the
For what?
poll because I'm been changed.
Who's that?
contractor?
So he's still working?
No, mom, listen to a voice message I got.
Hold on, I'm trying to mute all. Gigi, can you do you see the poll at the bottom? It's not letting me do it, even though I'm,
No, I don't see it coming through.
no. All right.
There it is.
Oh, you got it? Thank you. Yeah, I got logged off.
I got it.
It's just a couple
Is this a poll that you want us to take?
Yes, please. There's just a couple of questions. We do it week to week, looking for information about who's on the call. Oh, great, great. I see Maria did the poll. There's a different poll in the emails that we sent out that has a couple more questions about, you know, what county are you in? What would make sense for the closest training site? Do you need a laptop or not? Because some people may already have laptops and prefer to use their own. So there's two polls, one that we do at the end of each of these calls and the one that went out in the email. All right, are there any more questions?
Oh, yes, I do.
Okay.
Okay. So I'm serving right now, and I'm in the U.S. Military National Guard of Connecticut. So I have a duty that is going to be on the 3rd, on the 4th, on the 5th. So those 3 days, I'm going to have to go to Massachusetts for 3 days. It's going to be it'll be like training out of state. So I know the training is going to be for on the June 1st, 2nd, and 3rd of the 3 days that we're talking about. So on the last day, I think I can't miss that the duty because that's why I have to go for it. So I don't know how we're gonna work it out based on the date.
Honestly, they've told me that it's mandatory, the June 1st, 2nd, and 3rd. It would be
Okay.
because we are squeezing so much information into those 3 days with Kaplan training.
Okay.
That it would be really difficult you'd have to pass the test without doing the 3 full days with us. So
Okay. No.
that's this consistent answer they keep giving me when I ask.
Okay. No problem. I'm gonna I'll try to reach out to my superior if we can try to work it out with them, and since it's something that I definitely want to do, so they'll try to work it out with me.
Okay, and you have our email address if you need to send it in and tell us something different.
No problem. Thank you.
Thank you for your services.
Yeah.
Welcome, man. Thank you. Okay.
We are going to be providing laptops the first day of training to people who need them. If people already have their own laptop and they prefer that, we understand. And that's part of the poll in the Monday email that we sent to you, that you would click there and do that. I think it's like 8 questions and tell us whether you need a laptop or not. So We will definitely provide it. We want you to be successful, just like we're paying for the training and we're paying for the exam and connecting you to the broker mentors. We think that that's going to make a difference to help you. I don't see any other questions.
What is a certified application counselor? They mentioned that in the survey that we got in
Yes,
the email.
Maria.
Yes.
We talked about it the last couple of weeks. So we have certified application counselors with our community partners. And those are people that get some training with us and they can help walk people through the application process. So you might find them at our navigator sites, at Community Renewal Team or Project Access Haven, or any of the hospitals, the community health centers. It's not the level of a broker. It's a lower level, and with the access they have to our systems, and they help walk people through the process, and they can help them if they have a problem. They can call in the 855 number with them.
And if we wanted to do that, is that something that we could enroll to learn that or to apply for jobs that are like that?
It's not a job. It's part of whatever somebody's current job is. So at a lot of our community partners, it's like a tool in their toolkit.
Yeah,
so they're already helping clients with housing, with food, with other needs.
Energy.
And then it gives them a better understanding of what Access Health Connecticut is. So they know that we help people with Husky, we help people with Covered Connecticut, and we help people with qualified health plans.
I get it.
It's more like a tool.
Yeah. Thanks.
You're welcome. Thank you. Hi, Denise. I see your hand up.
Hello, everyone. I was going back to when someone was saying if you were going to be referring them to their clients that they're going to be receiving, and then it was mentioned, about the certified application counselors. I would suggest to get to know your certified application counselors, right? Because they're the ones that's going to be doing the applications, and they're going to be the ones referring the people to the brokers. So, if they have your card and you're local, they would probably refer them to you.
I think it's a great suggestion. Denise works at one of our community partners in Waterbury. And so what they do is sometimes they do enroll. And if they get stuck, or if somebody has a question, which policy makes sense for them, they'll refer them to a broker. So we have that at a lot of our community partners. They have relationships with local brokers. But again, we just refer on our website. Thank you, Denise.
Sometimes people need to sit with someone face to face, so the ones that you have that are like, oh, I want to sit down with somebody. I need to see their face. I want to talk to them. So then that's when they would probably, refer them to their local broker. So it's good to know who they are.
I think that's a great suggestion. Thank you. I'm looking, I don't see any more hands up.
Once we write a policy for a small business or an individual, do we receive, since we're finding our own leads, do we receive residual income on premiums paid and all of that?
Yes, they're going to be talking about that during training. The way brokers get paid is when they are appointed by a carrier to sell their to enroll people in their health insurance. They get paid from the insurance company. What happens with the laptops after training? You get to keep the laptop as you go forward. They'll have, that's really all there is to say. They want you to be successful. They're giving you a laptop if you need one. They are refurbished laptops, and they're Dell. So, thank you, Maria. Thank you, everybody. Your questions make the class so much better. We really appreciate you taking the time to join us. And Tuesday next week, I think is going to be a great class on effective communications. We want to help people have like their 30-second pitch, because sometimes you can stumble over your words when you're introducing yourself, and we thought it would be helpful to have a professional come and talk to you guys. So thank you guys for joining us today. You're welcome to leave the call now. Oh, Denise, I see your hand up.
Thank you.
Thank you. Thank you, everybody. Your questions make the class so much better. We really appreciate you taking the time to join us. And Tuesday next week, I think is going to be a great class on effective communications. We want to help people have like their 30-second pitch, because sometimes you can stumble over your words when you're introducing yourself, and we thought it would be helpful to have a professional come and talk to you guys. So thank you guys for joining us today. You're welcome to leave the call now. Oh. And we thank you for doing the poll. And remember, turn in any documents if you're missing them, and also go to that Monday email from us and complete that poll to help us. Thank you.
Good
Have
night,
a great
everyone.
night.
Thank
Good night.
you.
Have a nice evening.
Have a nice
Evening.
night.
Thank
Good
you.
night.
Good
Oh, I
night.
know, it's lovely out. It's beautiful. It's
Have a
nice
nice
to
night.
see the sun.
Good night,
Yeah.
everybody.
Awesome. Good
Good
night,
night.
Denise. Nice to see you. Okay. It's a little dizzying as everybody goes out, isn't it? Oops, stop recording.